Good day everyone! So now this is our first vlog. So for our first vlog, we will be discussing sensory assessment. So what is sensory examination?
Sensation. Sensation is a complex consisting of several modalities, including our four special senses. It is for vision, for hearing, for smell, and for taste. And also our somatosensory senses, including tactile, light touch, and pressure, proprioception, temperature, and pain. Sensation plays a huge role in how we perceive our environment, impact on our control of movement, arousal, and provides warning of potential danger. The evaluation of sensation, or any sensory modality for that matter, is highly dependent on the ability and the desire of the patient to cooperate. Sensation belongs to the patient, and the examiner must therefore depend almost entirely of their reliability. Sensory changes that are unassociated with any other abnormalities must be considered weak evidence of disease, unless a pattern of loss in a classical sensory pattern is elicited. For example, is a typical pattern of nerve root distribution or dermatome.
For pain, first, the therapist must introduce to the patient the stimulus, which is sharp or dull. Next, the patient must close his eyes and identifying which type of stimulus is applied. For temperature, the therapist will be introducing two types of sensation, which is the cold and the warm. Then, the patient closes his eyes. Next, the patient will identify which type of sensation is applied. Lastly, the light touch. Simply introduce the light sensation such as cotton and compare it with a rough or dull sensation. Then have the patient close his eyes. And then, ask the patient to identify the type of sensation they are feeling. Kinesthesia. Kinesthesia, which also means movement sense, is the awareness of the position and movements of the parts of the body. First, demonstrate the test with patient watching. Then perform the test with the patient with closed eyes. The patient must be able to follow the movement. Proprioception. Proprioception is the sense of the relative position of body segments. It is the sense that indicates whether the body is moving with the appropriate effort and where the various segments of the body are located in relation to each other. First, demonstrate the test with the patient watching. Then perform them with their eyes closed. The patient must be able to identify the movement of the physician. Stereognosis. Stereognosis is the ability to recognize the form of the object by touch. A single object is placed in the hands of the patient and manipulates the object, and then identifies the item verbally. The patient is asked to name the item verbally. For the patient with speech impairments, the item manipulated can be identified from a group of images and then identifies the item verbally. Barognosis. Barognosis is the ability to recognize different ways A set of discrimination consisting of small objects of the same size and shape but of graduated weights is used. When the object is placed in the hand simultaneously, the patient is asked to compare the weight of the two objects. The patient's response is indicating the object is heavier or lighter. Graphesthesia. This test determines the ability to recognize the letter, number written on the skin. Using fingertip, a series of letters or numbers and shapes is traced on the patient's skin. The patient is asked to identify verbally the figure drawn on the skin.
So that's it for our today's vlog. If you like our video, just click the subscribe button below, and if you have any questions, don't forget to comment. Bye! See you!